Okay, thank you very much for the wonderful introduction, Prof. Ratna. So I am Dr. Nadia. Assalamualaikum and a very good morning to everyone. I'll be talking about transforming care through understanding needs among colorectal cancer survivors. So to understand needs, we actually develop a needs assessment tools which is specific among colorectal cancer survivors in Malaysia. Sorry. Okay, sorry, some technical issues. Okay, while he's preparing the slides, I would like to mention and I would like to bring your attention to a slogan which is "Nothing about us without us." This is actually a very powerful slogan that highlights the needs or the importance of incorporating or including cancer survivor, because whenever we want to do any policy changes or any program, those who are affected in the condition should be included. Now, when we talk about survivorship, it's not just only talking about treatment, talking about medication. Survivorship encompasses a lot of other things besides just treatment. So the needs of cancer survivor actually started at the point of their diagnosis through the remaining years of their life. So these are some of the slogan or quotes from ESMO, Patient Guide Survivorship. So if you can see at the slogan, patients actually want more information about their condition. They want to know more about cancer recurrence. Then they think that information or knowledge is power. Now, talking about colorectal cancer, as we know, colorectal cancer is the second most common cancer, according to Globacon, among men and women in Malaysia. But, and in view of advances in terms of technology, there's a growing proportion of long-term survivors. And the needs of cancer survivors do not vanish when treatment has been completed, and is highly dependent on their cultural and religious background as well. So when we talk about survivorship, it also encompasses other things, including emotional support, psychological well-being, and a lot of other things, not just focusing on medical care. So needs is defined as the level of services or support that individual perceive as necessary to achieve optimal well-being following cancer. And again, emphasizing that needs persist even after treatment has been completed, and it depends on the cultural, religious background and healthcare setting as well. And needs also were found to be significantly associated with quality of life. Since there is no needs assessment available, there is needs assessment available, but there is no standard needs assessment available throughout the world. And the available needs assessment actually were developed in Western countries with different healthcare settings. So that's why we actually developed a needs assessment tools that is specific among our survivors. So we conducted a study where this is our research objective, which is to develop and validate a needs assessment questionnaire that is specific to multi-ethnic colorectal cancer survivors in Malaysia to determine the prevalence of needs and also the factors associated with various needs. So the study was actually conducted in two major phases, where phase 1 involved in the development and validation of the questionnaire, where in phase 1 there is three stages, which is the item development, skill development, and skill evaluation. So the questionnaire development is the tedious process where there's a lot of meticulous methodological analysis going on. Okay, so under skill, and we incorporated co-design technique at this phase, where we include cancer survivor, the colorectal cancer survivor, from the beginning of the questionnaire development until the end of the process. Again, highlighting the slogan, "Nothing about us without us." Okay. So we did exploratory factor analysis and the skill development, and also the under skill evaluation. Confirmatory factor analysis was conducted using SMART PLS. So it resulted in a good psychometric task, a good psychometric properties questionnaire. So the validated questionnaire were named as NCCM, which is a short for Need Assessment Tools for Colorectal Cancer. And then we incorporated the developed NCCM in a cross-sectional study where we would like to look at the prevalence and the factors associated with needs. Now, the questionnaire that were developed have resulted in 48 items in 6 domains and in dual language. So this questionnaire, we developed the questionnaire in dual language because we believe that it could offer a composite understanding where most of our Malaysian will be able to understand English and Bahasa Melayu. So for the needs domain, for the diagnosis needs, we are actually assessing needs at the point of diagnosis, where we ask the cancer survivor what are their needs when they were diagnosed with cancer, while the remaining domain were assessing needs for the past 1 month. So uniquely, for the employment needs, we are actually focusing on those who are currently employed or recently lost their job because of cancer. So from the newly developed questionnaire, we actually incorporated it into a cross-sectional study where the study site involved in private institution, public institution, as well as academic institution. Multiple referral oncology referral center in Malaysia. So we did a simple random sampling for the sampling method, and all those aged 18 and above who had been diagnosed with colorectal cancer in any stages were recruited, and those with or without stoma. But those who are terminally ill or unable to understand English or Bahasa were excluded. Now, these are the result of the findings, where we managed to recruit 630 respondent colorectal cancer survivors. So I did receive a question previously on how do we actually recruited 630 respondents. So the answer at that time was with blood, tears, and sweat. Yeah, so it's not easy, but we are grateful that we managed to recruit such number. So we got, so the result shows that we have quite equal distribution in terms of those aged above and below 60, and quite equal distribution in terms of gender. There's a high proportion of those in B40 group and those without insured ownership, those who are diagnosed with late stage of cancer, stage 3 and 4, and those who had 80% of the survivors had undergone surgery, while at least 55 had their primary follow-up in government hospital. So these are the distribution of needs among people living with colorectal cancer. As you can see, there is a high to very high needs when it comes to diagnosis, psychosocial, healthcare needs, but other needs domain are also still concerning. And these are some of the items or the questions that we asked to the survivor, and we are surprised that most of the survivor, about 83.7%, actually indicates that they want more information when it comes to diet. And 72% actually would like their healthcare practitioner or attending doctor to be more empathy, especially at the point of diagnosis. And 61% also would like to know more about traditional and complementary medicine, and they want this to be discussed by the oncologist, not just focusing on medical care. Now, to understand further what are the factors associated with the different needs domain, we did a multivariable analysis where generalized linear regression analysis was conducted using JAPS software. So these are the significant factors associated with needs, and as you can see that those younger age group were more likely to have high needs in terms of financial and employment. So women are more likely to have high psychosocial need, and those Malay ethnicity were more likely to have high diagnosis and psychosocial need. And inversely, those who had their follow-up in private hospital were less likely to have high needs across multiple domains. And those who have healthcare insurance, they actually were also less likely to have financial needs. And we also look into the association of needs with quality of life, and we also found a significant finding where those with high needs actually have inverse association with quality of life. Means that those with high needs has poor scores in their quality of life questionnaire. So just a recap of the finding. I would like to emphasize again that there is a high need when it comes to psychosocial information need, employment needs as well as financial needs. So the high needs across this domain actually highlight the importance of having established psycho-oncology services in the country. But that being said, even in the National Strategic Plan for Cancer Control, although it was highlighted that the focus should be on quality of life and psychosocial support, we still have lack services when it comes to psycho-oncology. So in the government setting, there is no psycho-oncology services available, and those who need any help will be referred to the psychiatrist instead. Okay, so from the findings, we hope that it could provide a data-driven insight for a key provision of patient-centered care. And we hope that the findings of this study will also enable intervention program and survivorship care plan in the country. And having the developed questionnaire, which have good psychometric properties, we hope that it could also be incorporated as part of the clinical practice guideline, so that when the doctor is seeing the patient, they're not only treating the disease, but also looking into other perspectives, including needs among cancer survivors. And multi-stakeholder collaboration is very important to achieve the change, because policy change takes time, and we believe that by working together, it could actually improve the quality of life of cancer survivors. And when we talk about policy, there's high employment needs among cancer survivors. And in Malaysia, we do not have any employment protection policy. So this is something that the government should also look into. So without the employment protection policy, cancer survivor is having issue such as losing their job, and they have issue in returning to work after cancer diagnosis. We have programs like patient navigation, and I would like to say congratulations to NCCM, because they had developed a patient navigation model where they actually train peer supporter to help other patients, and not just focusing on cancer, they train peer supporter for other patient group as well. Again, emphasizing the needs of having in-place psycho-oncology services in the country. And in terms of financial navigation, although there are some available programs, but it was not streamlined, and it is not easily accessible in our country. So when it comes to future research direction, we still believe that co-creation is very important, and we hope to actually expand the study into a longitudinal study, which is a cohort study, in order for us to understand the changes of needs across time. And we believe that continuous research and dissemination of findings will actually pave way towards policy change. Now, as a conclusion, NCCM is a reliable, valid instrument with low respondent burden. And the high prevalence of needs actually highlights the urgent needs for intervention, and we hope that from the findings, it's actually able to facilitate the prioritization in planning of survivorship care in the country. Now, before I end, because the timekeepers keep looking at me, so I would like to share some untold story or the beauty against completing this research. So it's not just about data, it's not just about having something to present, but I would like to also highlight the challenges. There's a lot of challenges. I think when you want to complete any research, there's challenges, especially during the data collection. Suddenly COVID-19 pandemic hits, and we have to change our mode of recruitment from face-to-face to online and voice VC, video conference, video calls, and so on. But along the journey, I meet a lot of inspiring people, a lot of people who taught me the value of life. Okay, and I'm actually very happy because through completing the research, I've been working together with Coram. So we have Coram here with yesterday, Encik Azri, and besides that, through Coram we actually created a Suara Kita Coalition, which is a group of different support patient navigator, patient group that actually work together in order to amplify the collective voices of patient and survivor. So again, we also have the president of Suara Kita with us today, Mr. Shakir, and I think that the journey is rewarding. So we hope that from the data that we have, there is some improvement that could actually pave way to policy change for the better future, and also to improve the quality of life of cancer survivors. With that, I thank you.